Hello, I'm LeeAnne Ruff. In every community, there are leaders whose work quietly shapes lives in ways we don't always see. Joining me in the studio today is Katherine Cook of Plattsburgh, New York. She's the CEO of Behavioral Health Services North and a leader whose commitment to mental health and community well-being benefits our region every single day. Welcome, Katherine.
Thank you for having me, LeeAnne. I'm happy to be here.
Well, I'm excited to have you because I think that you have a very interesting story to tell, and it's centered around what you do, and that is you are the CEO, the leader of a very large team of Behavioral Health Services North. But tell people, what actually is that?
Well, we are a full-service community mental health center, and that means that we offer numerous types of services, everything from your basic clinical counseling to emergency mobile mental health crisis intervention, residential treatment, psychiatric services. We offer stop domestic and interpersonal violence services. We offer therapeutic foster care, healthy families initiatives, so many programs, over 25 programs actually.
Wow, so that is a very large impact.
Yes.
But I think it's really interesting to note that I didn't realize until more recently was that you are not just Plattsburgh based. Your region is very large. You actually go all the way down. You have an office in Queensbury, correct?
And Hudson Falls.
Oh, okay.
Yes,
So
we
Sam,
serve numerous
more.
counties, right? We serve
Wow.
most notably Clinton County, Warren, Washington, Essex, and Franklin counties. But we also have some work in Saratoga County as well in some of our school-based clinics.
Wow, and that is so impactful, I would think, to our region. And that's a very vital job that you have, leading a team of what, over 600 now?
Correct. We'll have over 600 staff as of Monday.
That's amazing. Congratulations.
Thank you.
But here's the story. I want the story of Katherine, because how did you get here from when you were young? Like, tell us about that.
Well, it's probably not a short journey because there's many years there, right? But, you know, I grew up in a rural town in Ohio, and my parents were deeply committed to the community, and they showed that commitment by attending a local church and participating in every church supper that they could. They volunteered with the local fire department. There wasn't a birth or a marriage or a bridal shower or a baby shower or a death that we didn't bring a meal to. And they used their way of being in the world to minister to people's hearts and souls. And so I think they modeled for me the importance of connection in a community and what that looks like. And so as I went through my formative years and went off to college, I thought I was going to go into business school and move away from the country, right? And somewhere along that trajectory, I changed my mind and got into human services. And that came about because I started volunteering at an AIDS service organization in the late 80s.
Wow.
And that was the time of ACT UP, and that was a time of when silence equaled death, and when people were really ostracized. And that for me, that was a point in time where I could connect with people. I wasn't afraid to do that work. I could sit alongside somebody and listen to them and minister to their soul, if you will, just by the very act of being with them. And that opened up a whole world for me. At that time, I was mostly working with individuals who were intravenous drug users and were homeless, and also HIV infected. And so
let me back up though. So were you out on the streets working with them? Like what did that look like for you? You were in college, you had just gotten out of college, like
yeah, so I was in college and I was volunteering at a little local AIDS service organization where people would come in just to get food or rental assistance or help with housing or just have somebody to talk with. And from there, that led me to look for paid employment within the same field. And one of my first official roles was as an intensive case manager to work with people who were seriously mentally ill, or at least that's how they were described at that time. And so I worked in that capacity. I worked a little bit on a mobile outreach team in the city looking for people who needed services who were homeless. Quite frankly, I've worked in every possible discipline within community mental health, except for being the chief financial officer or a medical provider. But I've been a direct care worker. I have worked in residential programs. I've worked on street outreach teams and community mental health evaluation teams. I've been a therapist. I've had an equine assisted therapy practice, and all the way now to being an administrator. It's been a long journey.
It sounds like a very interesting journey because you've done so many different roles on your way to where you are now. Where did that take you?
You know, my work has taken me across New England, and part of each iteration of my growth, I tended to go to a new state to learn both the policy and the procedures of how mental health service was delivered in each state. And I sort of made it my mission to figure out on a regional level how community mental health was delivered, where both its strengths and its weaknesses lie. And so each time I've moved, I've taken those lessons with me and have tried to bring them to this role today.
You're in a role where you are constantly supporting other people, right? So who supported you?
When I made the leap from Maine to New Hampshire, I had the opportunity of getting to work with a gentleman by the name of Ken Jew. And Ken was my professional mentor for many, many years. He's most notably known for his work in the InShape program, which was a program created to offer support for folks who had been diagnosed with a mental illness. He shared with me the importance of community organizing to make an impact, to really leverage the strength of the people that are in your neighborhood and in your villages and in your towns to come out and support the wellness of the community. And so as a small community mental health agency, we had to be a part of the fabric of the community. It wasn't just enough to, you know, sit on the corner and have your business, but to really be involved with your neighbors and to figure out what's working and what's not working.
You worked in many different states in New England, and I think all of them, right? And now you're here in New York. And so was it his influence to guide you to find the opportunities to, you know, develop as a leader?
What a great question to reflect on, because every time I've made a shift in my journey, I consulted with Ken, and I would talk with him about the pros and cons of these decisions and what he thought I might need to work on or what gifts I could bring. And it was when I moved to Plattsburgh, Ken had passed, and this was the first position that I have taken without consulting him. But I do have to think that he's pretty proud of this particular role for me and just the great work that my team is doing.
It's always, I think, very important for people to have a champion, right? And it's I think sometimes even as women, we try to think that we can handle it all on our own, but to realize that there are people out there that we can lean on. And so it's great to hear that part of your story, that you didn't have to claw your way through it all on your own. You had someone's voice there saying, well, maybe you ought to consider this, or maybe take a look at that kind of thing.
You know, I think it does take a village, right, to achieve great things. And I would add that I'm grateful for this role, but I couldn't do this role without my team.
Yes,
It's
it sounds
really
like
all of
you
us
have
working
an
together.
amazing team. And I want to say not only is your team amazing, but our community where you live, you know, you've had to integrate into a space where there are a lot of really great people trying to do great things. Yeah. What is your hope for the region with your role and the lens that you look through? What is your hope for our area?
My hope is that with an agency as large as ours and with all of the other dedicated professionals and service organizations in the area, that we can all figure out how it is that we work together to best meet the needs of our community. You know, I'm a strong believer in collaboration and community organizing, and that in order to do the work, we have to do it collectively rather than competitively.
I think that's a key piece to how your story started. You were very ingrained in the community, and you have a great thread of community through all the roles that you've had. So it's wonderful. It's going to be wonderful to see how you continue that thread here in our region.
I'm glad to be a part of this community, and I look forward to that. I look forward to it, and I'm up for the challenge.
That's awesome.
Yeah.
As we wrap this up, I want to ask you, Katherine, what continues to matter most to you in the work that you do?
I think what's most important is really connecting, and that as humans we have an opportunity to come together during this time where people are really feeling lonely and disconnected, that it's so important for us to slow down and to stop and to listen and to connect with one another. And that's really at the heart of healing. I really think that's at the heart of wellness. We often say that connection is care. And it couldn't be more simple than that.
Thank you so much for joining us today.
Thank you, and thank you to the community for welcoming me.
For more information about Behavioral Health Services North and the resources they provide, visit bhsn.org.